Health Beat with Dr. Benita Zahn.
And welcome. Everybody's chomping at the bit to get back to normal. Yes, vaccination rates are rising, but so are infection rates in some areas. So how to tamp that down and still get us to President Biden's goal of seeing small gatherings of friends and family at homes by July 4th. Dr. David Holtgrave, the Dean of the School of Public Health at Albany, recently released a set of 6 interim COVID goals for April through May and June to get us to that day to celebrate our freedom, and he is our guest here. Welcome, Dr. Holtgrave.
Great. Thank you very much for having me.
This is, you've got 6 points, and it's thought-provoking, and they sound a little bit aggressive to me. So let's start with your first point, and it deals with vaccinations.
Yes, exactly. Well, we thought to do this piece, as you said, the president's laid out a goal of trying to get to at least small gatherings of family and friends by the 4th of July. And we wanted to ask ourselves, what would be a set of the many possible interim goals that would need to be achieved if we're going to actually get to that place about 90 days from now by the 4th of July? And so this set of 6 goals, we think, if actually achieved, would get us there to make that midsummer dream a reality. And as you said, one of the first things that we mentioned was vaccine use. So now in the U.S., about 20% of people are fully vaccinated, of adults are fully vaccinated. And we were proposing trying to get that up to about 90% by the end of June, so before the 4th of July. And that you're right, that may seem aggressive, but if we could do that, it would actually be consistent with something that the president said this week even, and that was by April 19th, about 90% of all adults in the U.S. Will be eligible to be vaccinated in their respective states, and that about 90% of adults will live within about 5 miles of a vaccination site. So even though that 90% may seem high from where we're at now with 20%, I think it's consistent with what we're seeing in different states where more and more people are becoming eligible to get the vaccine. And the question now is, how do we make sure that we maintain our current level of vaccination? To get to 90%, it would mean about 180 million more people vaccinated fully in the U.S. That's about 2 million people a day.
And let me jump in, though.
I'm sorry.
That's right. We always have a little bit of delay. That's an aggressive goal, one you believe is doable. However, you still have a segment of the population that says, no way, no how, ain't never going to take that shot.
So I think that's an important point. I think what we need to make sure that we do is talk about the benefits of vaccination, talk about what becomes more possible as people are vaccinated, either individually or collectively. And also, I think we need a wide variety of spokespersons from various different parts of life, different parts of society, to come forward and talk about the benefits of being vaccinated and maybe showing that they too were vaccinated and what these benefits were.
We recently saw Senate Minority Leader Mitch McConnell come out and say, he took the shot, you take the shot too. One of the other things that's also quite political is mask wearing, and that really does top your list of the 6 items, and that the interim goal is that 90% of people in the U.S. will consistently and properly wear their masks, and that also ties into continuing the existing policies that we've got about social distancing and things like that. How do you get the mask use up?
Well, I think for mask use now, about 70% of people in the U.S. say that they consistently use masks when they're out in public. So this interim goal would be really trying to call for going from about that 70% level to more like a 90% level. And I think there too, we need to make sure that we're talking about the benefits of mask use. We need to have people talking about what those benefits are. And we need to also make that decision not only collectively, but individually, no matter what the requirements are, at a place of business, in a state, in a city, wherever. Mask use is an individual decision that we can all make. And even though it may be seen as a bit burdensome in the near term, it's a relatively small price to pay for some of the public health benefits that we get from it.
Yeah, we are also seeing states that are saying, no mask, come on, it's okay, you know, let me see your smile. And that lies in the face of what you're recommending.
Yes, I think one of the other things we thought was really important was that states and cities, localities that are now rolling back some of their precautionary policies may want to put in at least a temporary pause on those. We all want to be able to dispense with those policies in the long term, but to have a temporary pause just for this period to get us through until the vaccine uptake gets a bit higher. And that's really important in the face of the variants that we're seeing. Now we've got variants like B117 and B1526. While we see those variants out there that are becoming the predominant strain, it appears, in the US, now is really a time to making sure that we keep some of those precautions in place.
Yeah, and that's a big part of the reason why we're seeing the numbers increase, even as we're seeing vaccinations on the climb. The fourth point was interesting, is at least 90% of symptomatic persons diagnosed as having COVID-19 should be successfully engaged in care and medical remedies that are available, which says to me, you mean people are not being treated for COVID?
Well, it's an interesting point. So people in general are being treated, but our point, I think, was to say that diagnoses and access to treatment should happen as early as possible in the course of illness. When we look at the NIH treatment guidelines, and it lays out what are the different strategies for treating people with COVID-19 illness, one of the things that we see is that some of those treatments need to be delivered as early as possible after the onset of symptoms. So things like monoclonal antibodies or combination of monoclonal antibody treatments. And we thought it was really important to include in this list of interim goals not only the precautionary preventive measures like vaccines and mask use and so on, but also making sure that people who become symptomatic, who do get ill, get access to all the treatments that might help them. And some of those need to be delivered early on in the course of disease. So
well,
we wanted to
let me jump
point.
in. Doctors have to understand that as well, because I've got friends who have asked and reached out for the monoclonal antibodies, for the cocktails, and they've been waved off. So we've got a disconnect here.
Yeah, I think that's an important point that you're raising, in that we have to make sure that not only are people diagnosed early, but there's systems in place for that kind of access to care. And it seems like maybe some of these treatments for earlier on in the course of illness are not being accessed as much as they could be for any number of reasons, including maybe healthcare system reasons that you're raising. So I do think this is a really important conversation to have. And
to the end of all of this, you contend that we should be seeing deaths from COVID no more than 50 per day, to which, a lot of people would be, raising a lot of praise. But at the heart of this, and you just touched on it, is you're also the sixth item is to eliminate the disparities in healthcare, and that's a very big lift.
It is a big lift, and I think two things, just to go back to your point about the 50 deaths for a moment, is of course, since this is largely preventable, we would like to see that down to 0. But the reason we chose 50 for this article, 50 per day, is that we're at about 1,000 or so deaths per day now from COVID-19 in the US. And 50 is about the number of average influenza deaths per day that we see in a typical year. And influenza, of course, varies from year to year and month to month and day to day. But on average, the number of deaths from influenza is about 50 to about 100 deaths per day. So this gives it in the range of influenza instead of COVID-19. But you're exactly right about health disparities and health inequities. We've seen that COVID has so disproportionately impacted especially communities of color, Latinx communities, African American, and some Asian American and indigenous communities. And also in terms of vaccine uptake, we've seen differences in terms of access to vaccine, and especially for some communities of color. And our main point by including this as a sixth of these central goals is that in everything that we're talking about, whether it's access to mask use, access to vaccines, access to treatments, and also the fatality rates that we're talking about here, we always need to keep in mind this issue of health disparities and health equity, and make sure that we're making every step that we possibly can. And it is going to be a very important thing that we never lose sight of. So we wanted to make sure that was central in what we proposed.
I want to put the graphic back up so that people get a sense of a reminder. You're looking for 90% mask use, continue the existing policies, the social distancing of the sort, getting vaccination up to 90% for folks 18 and older, and 90% of people who are infected have them treated early and appropriately, so that you're limiting the COVID deaths to 50. And then the big one, I think, the eliminating health disparities, which Dr. Holtgrave becomes, if nothing else, a fabulous jumping off point for us to really look in the mirror and look ahead and see how to best be all-inclusive and even-handed as best we can to provide the best care. Thanks ever so much. Always great talking with you, and I'll look forward to our continued conversations. Dr. David Holtgrave, Dean of the School of Public Health at Albany. Thank you for checking out HealthBeat, your health info on the go. New programs post every Monday and Thursday. And by the way, the program that we had just before this one deals with our emotional attitude toward getting back to the world we once knew. So take a listen, take a watch to them as partners. Till next time.